Hi, my name is Sun Kuyu. I'm gonna have a sepsis for seminar presentation. So in this video, I'm gonna have a background of sepsis, definition, epidemiology, education campaigns, transmission, signs and symptoms, cause, diagnosis, high-risk groups, prevention and its strategies, management, long-term outcome and conclusion. Definition. Sepsis is the body's overwhelming and life-threatening response to infection that can lead to tissue damage, organ failure, and death. So basically, it is your body's uh, overactive toxic response to an infection. Sepsis, the case is 1.7 million cases per year in the state and 270,000 deaths per year in the United States. Septic shock is associated with the highest mortality, approaching 50%, and the incidence of severe sepsis is estimated to be 300 cases per 100,000 population in the state. One-fourth of the patients who develop severe sepsis will die during their hospitalization. The further increase in septicemia incidence and septicemia-related death is expected to continue due to aging of the population, increasing burden of chronic health conditions, and increased use of immunosuppressive therapy, transplantation, chemotherapy, and invasive procedures. But over the past 2 decades, the case fatality has declined due to advanced in supportive care for the critically ill, such as surviving sepsis campaign. So education campaigns are important factor to relieve the burden of sepsis in the community. Sepsis is not contagious. Sepsis cannot be transmitted from person to person, including sexual contact. However, sepsis does spread throughout the body via the blood system. So once you have a sepsis, you could have any organ damages, organ infections in your body. So if you have a sepsis, you could have high heart rate, fever, shivering, or feeling very cold, and confusions or disorientation, shortness of breath, extreme pain and discomfort, clammy and sweaty skin. Sepsis can result from an infection anywhere in your body, such as pneumonia, influenza, UTI, or trauma. So gram-negative organisms are the most frequent cause. In this table, you could see the types of organisms in patients with sepsis. As you see, gram-positive bacteria frequencies is 47%, and gram-negative organisms are about 62%, and anaerobes like about 4.5%, and fungi is about 20%, and parasites only 0.7%. This is the common site of infection in patients with sepsis. As you see, respiratory system is the most frequent. In males, about 42%, and in females, about 36%. And like a GU system, such as UTI, 10% in male and 18% in male. 18% in female. And we have other sites of infection here. So diagnosis of a broad spectrum of criteria of systemic inflammatory response syndrome, also known as SIRS, and sepsis and severe sepsis was proposed by American College of Chest Physicians and Society of Critical Care Medicine Consensus Conference in 1991. This criteria was revised in 2001 to include the infection and presence of any other diagnostic criteria, basically by the same group. This is the criteria. If we have a temperature to be over 38 degrees Celsius or less than 36, or if you have a heart rate over 90 times per minute, or hyperventilation evidenced by respiratory rate over 20 per minute, or arterial carbon dioxide level lower than 32, or WBC count over 12,000 cells or lower than 4,000. So if you have any of two of this criteria, then you have SIRS, SIRS. If we have a SIRS criteria with a presumed proven infection, that is sepsis. If you have a sepsis with organ dysfunction, that is severe sepsis. If you have a sepsis with hypotension, despite adequate fluid resuscitation, that is septic shock. This is a revised version in 2001. So if we have any general parameters such as fever, hypothermia, tachycardia, tachypnea, altered mental status, or altered hypotension, decreased urine output, significant peripheral edema, or positive fluid balance, or if we have inflammatory parameters like leukocytosis, leukopenia, hyperglycemia, increased CRP, procalcitonin or creatinine, coagulation abnormalities, or increased cardiac output, reduced mixed venous oxygen saturation, or if you have hemodynamic parameters like hypotension, elevated mixed venous oxygen saturation, elevated cardiac index, or if you have organ dysfunction parameters like arterial hyperemia, hypoxemia, acute oliguria, increase in creatinine level, elevated international normalizer ratio, such as INR, or activated partial thromboplastin time, or ileus thrombocytopenia, hypobilirubinemia. If you have tissue pupillary parameters like hypolactatemia, or decreased capillary refill, or mottling. So if you have any signs of this criteria with documented infection, that is sepsis, according to the revised version of criteria of sepsis. This is high-risk groups like infants, seniors, male genders, and Black race, people with chronic or serious illness such as diabetes, cancer, and those who have an impaired immune system such as age, like HIV infection, they are high-risk group. Prevention. Sepsis cannot be always prevented, but by knowing the sepsis risk factors, you could reduce your chances of developing sepsis. Sepsis can be caused by any types of infection, bacterial, viral, fungal, or even parasitic. Many infections can be prevented by simply by good and conscious hygiene. Others can be prevented through the usual vaccinations. So early recognition and treatment have greatly improved morbidity and mortality. This is for prevention strategy. So as I mentioned earlier, vaccination is very effective, like such as chickenpox, tetanus, polio, and influenza vaccine. And wound care is also very important because every cut, scrape, or break in the skin can allow bacteria to enter your body that could cause an infection. And treating infection properly, the proper medication that kill bacteria, virus, or parasite to stop them from reproducing. Hand washing is very simple but effective strategy to prevent sepsis. Management, fluid resuscitation and broad spectrum antibodies, preferably within the first hour until more directed antibodies are determined by source and cultures. And those with suspected sepsis will be closely monitored in ICU. And septic shock may require more invasive interventions like intubation or vagal pressures. Low-dose corticosteroid may be used, and surgery may be needed to remove source of infection, such as abscesses, infected tissues, or gangrene. This is long-term outcome: increased mortality risk and persistent cognitive and functional impairment, and worsen pre-existing chronic disease or new chronic disease may emerge, renal failure, and eventually lead to chronic dialysis. So conclusion, sepsis is the leading cause of death in the United States. Acute infection worsen pre-existing chronic disease or result in new chronic disease, which result in burden of community health and resource management. People of old age, male gender, Black race, and pre-existing chronic health conditions are prone to develop severe sepsis. Thus, prevention strategies should be targeted at these vulnerable population. Here's a reference. Thank you so much to watch. Thank you.